Hi, and welcome to our latest via virtual webinar, Surviving COVID-19, Stories of Perseverance and Inspiration. I'm the co-MC today, along with my colleague and fellow VIA ambassador, Fatma. We are proud to bring you this event today, which shares uplifting stories that came from this pandemic. To learn more about how people and businesses have been affected and how we can overcome the current challenges. And last but not least, to pay very special tribute to the frontline workers who are at the forefront of this crisis.
On behalf of everyone at VIA, I extend a warm welcome to all our speakers today, including our guest of honor, Dr. Shamsaluta from the Ministry of Health and Prevention, who will be doing a special Q&A session with us during this event. But first, we have a message from VIA's Group CEO, Mr. Khalid Al-Hraimul, to start our proceedings.
Assalamu alaikum and welcome once again to our honored guest and my fellow colleagues. Today we will discuss a topic that has affected all of us, the COVID-19 pandemic, and share stories of inspiration, dedication and hope. We are fortunate to be in a country as prepared and proactive as the UAE. Our government took bold, decisive action to safeguard the public and has continued to act with resolve to control the spread of the coronavirus. As a company focused on social impact and sustainability, VIA has demonstrated leadership by example during the crisis. We were a key partner in the UAE National Disinfection Program, utilizing a workforce of around 3,000 workers every night for 3 months. To help businesses, we launched disinfection and sanitization services for companies. And to aid the community more generally, we launched many community awareness initiatives around the pandemic. For our workforce, we took every possible measure to ensure their safety, especially our frontline essential workers, who continue to ensure clean and sanitized environments for the communities we serve. All these efforts were aimed at containing the virus and educating the community about how we protect ourselves and others. With all this in mind, I am pleased to welcome you to today's event. I hope we will all gain new insights which we can share with our families, friends and colleagues. Thank you again to our special guests for your participation. To everyone watching, please enjoy the rest of the event.
Thank you, Mr. Khalid, for your insightful words. I am now very excited to introduce our fireside chat entitled Living in a Time of COVID. Joining me for this discussion are Mohammed Al-Holi, an Emirati student who was in the US when the pandemic hit and the airports closed. During his repatriation by the UAE government, he began feeling the symptoms of COVID-19 on the flight home and subsequently tested positive. Thankfully, he made a full recovery.
Hello, everyone. I would like to thank you for inviting me to be part of this webinar. Yes, I was in the US when coronavirus first began. At first, I didn't take COVID seriously. I thought I wouldn't get it because I'm still young and healthy. And since it started in China, I said it takes time to get to the US. And I was moving around the city, living my normal life, attending classes, meeting friends without putting any social distance and without wearing a mask. So then the airport started closing and the government told us to go back to the UAE. They sent us a flight and we came back to the UAE. On the way back in the flight, I started feeling sick. So once the flight landed, we got tested in the airport and sent directly to the hotel where we had to undergo isolation for 2 weeks. In 2 days, I got a call informing me that my result is positive and that the ambulance is on its way to pick me up to take me to the hospital.
That sounds like a really uncertain hectic period for you. What was your experience of the UAE medical procedures once you returned, Mohammed?
The medical procedures were a bit tough, but it showed how much they cared about the UAE people. The isolation process showed how UAE cares about the people and how they don't want the virus to spread more. So not having my family by my side in the hospital, it was hard. Especially I was the whole time by myself. But thankfully, the nurses were sweet and caring, which made me feel better. They checked up on us like 4 times a day, making sure we're getting better. And thanks to the UAE medical procedure and the care of the hospital, I cured from COVID-19 and went back home safely.
Thank you very much, Mohammed, for sharing your experience, and we are really glad that you made full recovery.
Thank you.
And now we would like to also speak with Mrs. Nada Haj, a charge nurse from Ajman Medical District. Nada is a professional nurse who has spent the past few months witnessing the worst effects of coronavirus, contracted it, and made a full recovery before returning to work. She embodies the dedication, bravery, and professional response by frontline workers in the healthcare sector. So Nada, I understand that you yourself contracted the virus. Could you tell us more about your work and what it has been like to be on the front line of the COVID crisis? Nada?
Okay, you can hear me now?
Yes, we can hear.
Yes. Assalamu alaikum. Thank you very much for inviting me to this event. As I am a health worker, all of us, we know the first front line. We are the nurses, doctors, all healthcare providers. All of us, we are, I can say, we are like soldiers, and they are heroes in fight with this coronavirus, which it is invisible enemy actually, and sometimes deadly. And this COVID-19, it make our work, our task harder than before, and our whole health organization or healthcare facilities, they supply us with enough, alhamdulillah, inventory of personal preventive equipments, that PPE, and all the staff, they are working and extended the hours with huge efforts, more than as usual. Everything actually it's changed for me, for my daily routine work, or even at home. And I think this has not only happened for me, but it has happened for all the people. And as we are healthcare workers, all of us, as me, I understand the risk that I'm exposed to it every day, and the risk I'm taking. Maybe I will take this transmission and this virus to my family, and we try, all of us, to have the precaution as much as we can to protect in the beginning ourselves and our families, and to ensure that I doesn't encounter this virus to my family. In this crisis, actually, it took me in different insight. Right now, I'm talking to you, and the life, it seems fun and beautiful and everything nice, but it doesn't that much when you deal with COVID patient, or not only me. I feel I'm in Hollywood movie, and with all these people who's wearing all protective gowns, shield, mask, shield, shoes cover, head cover, gloves, everything. Really, it's like a dream. We never think or thought we will work in like this environment in the hospital or in the isolation quarantine places, where it was in hotels or in buildings.
Yeah.
And you will feel now, it come to my head, even the children who's they are infected with COVID and they came with their families. As I'm a nurse and my colleague, we cannot talk with them, with these children normally, because we try ourselves to, with this mask, you cannot see the face impression or anything. We try to laugh loudly, to let them hear our laugh, to make some signs by our hand and to wave for them. We love you, our heart with you, because they cannot see our face. Even for ourselves, we cannot notice each other when we are, all of us, we are complete with cover. We don't know each other, only from the voice. And you know, in the beginning of this crisis, really, I noticed that the virus, it needs a huge effort from all the staff, from all medical staff, and we need to support each other. We need support team, because this virus, as I told you, it is invisible enemy, and it is something new, and it is something we don't know. We are dealing with what? With whom? Okay. When they called me to the work and with assigned team in the COVID management, because I work as a supervisor, the preparation period was stressful to ensure everything the patient care needs. It was really exhausting, and to follow up everything, every step of the precaution measures, and again, as a hand hygiene and disinfection, and so many things we are now something new for us. We are making the hand hygiene and these things, but not like when you have a coronavirus. And all these precautions, we need to take it. And also to ensure all the supervision and of the colleagues also, and they are compliant with all the measures. Despite all the measures and the precautions, me or others of the staff, we took it. And but يعني I make the regular swab for COVID, and the result, it was positive, and really it was a shock for me, because in the morning I was a supervisor, I work with the team, I don't have any symptoms, anything. I am a hypertensive patient. And you know, when you know you are COVID patient and you are medical team, your thoughts, your mind, your feeling will start to go in different way. You will start to have
I really appreciate.
you will start to have
I would like to say
concern and
I
worries.
appreciate your time to share your experience there with us. It's very, very much appreciating for us to do from your side to do that for us. I don't know what to say.
No problem. I can continue. I can continue now. But you know, the bad memories sometimes we call it. You will feel the moment. You know, I was worried about my children, about my husband, because he's a cardiac patient. I start to think bad thinking, and I need to go to isolation. They call me, even the staff, they cannot tell me directly, you are a sister, and it was a second day from Ramadan, and we are fasting. I finished my morning duty. I'm waiting for Adhan. They call me around 5 o'clock. They told me, sister, we don't know how to tell you. And what to tell you? I tell, what's wrong? They told me the swab, it came, the result. It not come to my mind, I am positive. Even zero, I will tell you 0.01%, it not come to my mind. Then they told me you are positive. Really, it was shock. And everything alhamdulillah, without any symptoms. Thanks God, Yani. When you will go to the isolation when you work in the morning, but not as a staff, as a patient. Thanks God, I finished the isolation period, and I make again the swab 2 times, 3 times. It was negative. And I go back to my home, but still it was very emotional and really out of the description this period. Again, I make before they enlist me in the duty rota again. I make again swab, and alhamdulillah it was negative. Thanks God. You know, one of our biggest challenge is to see colleagues and friends who were work together every day. They become infected with COVID-19. It was a big challenge to know how you need to make sure that more patients recover quickly, so that we don't overburden ourselves and health facilities. Thanks God, this period it's gone, and I finish it, and I can feel with the patients, especially when again I work as a supervisors and we pick the line for the patients and they are calling. They will tell me, you don't know the feeling. We are alone. We are lonely. You don't know how we feel. I tell them, I can't feel with you because I have this period. Thank you very much for this good question. Thank you.
Yeah, I would like to say thank you so much, my dear. I wish I can give you a virtual hug. I don't know if I can do it over Zoom, but honestly, we really appreciate all the effort, all the great effort that you have done. And I believe our prayers are always with you, with your family, and I hope, and I'm very glad, first of all, to see you safe and happy. And inshallah, the next period will be a very positive period for you. Yeah. And inshallah, maybe in the next couple, let's say months or weeks, inshallah, we can have a gathering all together as well with us and the team, inshallah. So as a frontline worker, Nada, I would just like to ask you, if I may, what would you like people to know about the work that is going behind the scene? I'm sure there's lots of things happening behind the scene that nobody really recognize or see. So can you tell us more about that?
Again, thank you for this question. And I think some of answer, I give it maybe indirect in the first question. But believe me, all of us as nurses, doctors, all the worker, even the worker who work with us and help us, because without this worker, we cannot finish our work. Not only the nurses, they are the first or front line. Even the people who's working in the border or the drivers, ambulance drivers, they are also frontline, and all of us, we take our precaution because we are afraid to have this virus and to transmit this virus to our family. Alhamdulillah, we as a healthcare providers, doctors, all these people, really we feel a pain when we see these patients. They are calling us the patients who infected with coronavirus, and they are ill or they become more sick. And we try our best to work with them or to give them as much as we can. Sometimes the smile, it will make the patient, he will reduce the pain nearly 50% from that one. The touch, when you touch the patient. And the isolation places, we try our best not to contact more with the patient. We try to be far as much as we can from the patients. We use telephone to call them, to ask them how are you, what you feel, what you need. Even if they have any symptoms, we ask them to describe the symptoms, signs and symptoms, and according to that, they give them the medication. Some people, they call us and they say, thank you very much. We appreciate your work, what you are doing for us. Really, these things, maybe it's very simple, but it makes some sense for us, something.
Thank you so much, Neda. I think it is in times like these that we really appreciate the healthcare sector and its worker for their dedication and sacrifice. Mohammed, my last question is for you. We are unfortunately seeing cases rise again in the UAE. You've witnessed COVID firsthand. How has your outlook changed, and what is your advice to UAE citizens and residents at this time?
My outlook has changed. I learned how to be patient since I am a person with zero patience, and probably I'm one of the people who took them too long to cure from COVID-19. I stayed there more than 40 days in one room by myself. So I feel what Nada's saying. Maybe I feel her even more since I've been there. And suddenly getting sick made me get closer to Allah and my family. And I started reading books and too many things that I didn't do before. Now we can see the cases are rising more than before, which is sad. My advice at this time is always to keep safe distance and wear mask outside the house. And soon, inshallah, we will win over COVID and life will come back better than before.
Thank you to our guests, Mohammed Al-Hawali and Nada Haj. We appreciate you joining us today to share your experiences and insights. We turn now to the next session, a Q&A with the Ministry of Health and Prevention.
Thank you.
Thank you very much. It is my honor now to welcome Dr. Shamsa Luta, Public Health Specialist at the Ministry of Health and Prevention, MOHAP. Through her work at the Ministry of Health, Dr. Shamsa has helped to establish a public health framework for the entire UAE and its response to COVID-19. She has also participated as a member of the National Health Security Action Plan in cooperation with the World Health Organization. Dr. Shamsa, the first confirmed case of COVID-19 was on January 29. Can you please tell us more about how did the Ministry of Health and Prevention formulate its response and also prepare for the pandemic in the early weeks?
Thank you, Noof and colleagues. It's my pleasure to be here a part of this webinar. As all we know that the first case of novel coronavirus was reported in December 2019 in Wuhan. Since then, the UAE has actively engaged to contain and control the spread of COVID-19, with activation of early system and activation of the National Plan to Combat Human Pandemics at both national and international levels. A technical advisory team of COVID-19 pandemics led by MOHAP, the Ministry of Health and Prevention, was established with multi-sectorial approach to assess the situations, recommend necessary measures on daily basis at all stages of the pandemic, addressing its consequences and follow up with the implementation. We follow a unique model in management of COVID-19 pandemics in the UAE, which already has an integrated level emergency system led by NCEMA. NCEMA is the National Crisis Emergency Management Authority. This system is designed to have a flexible, timely, and a high level of emergency preparedness and response for all types of emergencies, including health.
We are so proud of being part of the UAE, which has really led the way internationally, whether it comes to preventative measures or healthcare provision, testing, research, and vaccine trials. What really have been your biggest challenges, Dr. Shamsa, and successes with regards to these areas from the perspective of MOHAP?
Yeah, the COVID-19 crisis is continuous, and the UAE government's unwavering effort to curb the spread of the virus through implementing more exceptional measures and laws that are aimed to mitigate the impact of the virus in the country. The UAE is among the top in the world in health, safety, and leadership effectiveness. UAE implemented one of the ambitious and accessible testing programs globally. UAE taken measures to limit the spread of the virus. Our precautions are regularly upgraded and we are continuously monitored. Furthermore, UAE has conducted more than 8.8 million COVID tests since the beginning of the pandemic, with follow-up with the wise leadership, which we are very proud of. The country is still at the forefront of the world in total COVID tests compared to its population, transforming the challenge into an opportunity through the development of the UAE health capabilities during the crisis include supporting strategies with scientific-based assessment, quickly expanding of PCR tests to be available all over the country with our leadership logistic, while assigning fully equipped and qualified medical teams around the clock, with enhancing the capacity of the medical supply chains and covering the health insurance of the test treatment of the virus for all residents and citizens.
Yeah, this is very impressive, Dr. Shamsa. I'm certain with the Ministries of Health, efforts, the UAE is in safe hands. Could you talk more about MOHAB's vision for the coming months in terms of testing and ongoing vaccine trials?
Yeah, the COVID vaccine currently undergo phase 3 clinical trials. The vaccine is being made optionally available to healthcare workers on the front lines after showing a promising result so far. So the vaccine has been authorized for an emergency use as a part of the country measures to protect healthcare workers in close contact with COVID-19 patients and ensure their safety. And it's fully aligned with the regulations and laws that allow a faster review of licensing procedures. As all we know that more than 31,000 volunteers were a part of these trials, including more than 1,000 people underlying health conditions. Regarding the testing, the United Arab Emirates continues to widen the testing program and aims to cover all citizens and residents in the country.
That's great. Now, finally, how long do you think it will be before we get back to normal? And what is your message to the public with regards to achieving this goal?
As all we know that the COVID-19 is a new experience to the UAE and the entire world. So thankfully, our solidarity and leadership of the UAE that we are really proud of, we are able to face all stages of the pandemics. All medical teams in the UAE are working towards the ultimate goal in which protecting everyone and all the countries against the virus. The radiance was the most important weapon. Fast decision making, and as all we believe that there won't be a challenge that UAE will face. We will be over it.
Mm-hmm.
On my personal level, my main learning from this was getting to know people in different sectors with spirit of love and support. In face of common enemy, we were all able to work together to defeat it. The strong team spirit was truly clear and such an inspiration to me. The other thing is seeing what we have worked for years achieve its true value. Thankfully, with these plans, with great people, citizens, residents, and due to their love and support, we managed to overcome all these challenges. And it is the most important thing to learn from experience, as many as lessons that we can learn. Everyone should assume their responsibilities and adhere to the preventive measures to support the efforts of the frontliners and ease the pressure that they are experiencing. No one can predict what will happen, but however, we are sure that the UAE will emerge from this crisis, will get more stronger, and we will once again set an example of unity and cohesion between leadership and the people who continue to demonstrate a deep sense of awareness and responsibility in these extraordinary times. While easing the lockdown restrictions with reinforcing all preventive measures, there is a number of cases is still increasing. These are due to expectations of the specialists and scientists who suggested that the increase in cases is due to increase in testing numbers and gradual resumption economic and tourism activities around the world. My message is our responsibility to stop the spread of the virus by wearing face masks, keep social and physical distancing, and washing hands thoroughly, as well as following a healthy lifestyle, eating healthy food, exercising, and avoid smoking.
Thank you so much, Dr. Shamsa, for joining us today, and also to everyone at the Ministry of Health and Prevention for the work they are doing to keep us safe.
Pleasure is ours. Stay safe, stay home, stay safe.
Next up, We have a panel discussion of the topic, how businesses coped at the height of COVID. From air travel to events and businesses, various entities were dramatically affected by the restrictions placed to safeguard public health from COVID-19. Joining us today, we have Mr. Abdurrahman bin Tla'a, Head of Corporate Affairs and Investor Relations, Air Arabia, an airline that we are very familiar with and have flown on. Mr. Sugumaran Devaraja, Regional Director at the Dubai Overseas Center for Enterprise Singapore, the Singaporean government entity responsible for enterprise development. Mr. Tim Elliott, CEO of People Creative, a creative agency, and Alfam Shamsi, co-owner of 20 Grams, a specialty coffee cafe. The four speakers offer a unique perspective about how businesses have coped with the pandemic and expected changes going forward. I'll direct my first question to you, Mr. Abdurrahman bin Tla'a from Air Arabia. Prior to the lockdown, we had been seeing rapid growth in international tourism and increased demand for air travel. And then COVID happened. As airports and borders gradually reopen, how are airlines, especially low-cost carriers, coping?
Thank you, Fatma. Hi, everyone. This is Abdurrahman. Fatma, to answer your question, I think the MENA region and the GCC have indeed witnessed very rapid growth in the last few years and few months, in particular before COVID. This growth is obviously driven by businesses, demand, and tourism, which is a sector that is really important for the UAE and for its economy. Now, the magnitude of the lockdown that was caused by COVID is totally unprecedented. No matter how strong the risk department's plan is, no matter how pessimistic the management is, there is no airline in the world that expected or was even close to expect something of this nature of close down. The nature of the aviation business is that of very heavy costs, and therefore the impact, as you would imagine, is significant. Now that we are hopefully past the worst, that airports are gradually opening up, yet this opening up comes up with plenty of chaos. It comes up with fluid structure. It comes up with constant variability and change. We see countries opening up today and closing down again in 2-3 days' time, and so this keeps on moving back and forth. I can say that Air Arabia has been significantly responsive to the crisis. It has managed its costs ruthlessly during almost 3 months of zero operations. This period, to someone who is close to aviation, would know that is enough to knock down an airline without direct financial bailout from a government. As you very well noticed in your question, a low-cost model would help an airline combat such circumstances and make it better equipped to fight and stay standing. And that's where we are today.
Could you share more about the safety procedures that your sector has in place for the
I
safety
think you're
of
muted,
passengers?
Fatma.
Can you hear me now?
Fatma, would you try again? I think I missed the question.
Could you share more about the safety procedures that your sector has in place for the safety of passengers? And do you have any safety tips for those in our audience who might be boarding a flight in the coming months?
I'm sorry, I'm missing the question again. Let me try to switch the... Can you try now again, please? Sorry for the last time.
It's okay. Could you share more about the safety procedures that your sector has in place for the safety of passengers? And do you have any safety tips for those in our audience who might be boarding a flight in the coming months?
Okay. The safety of our employees, the safety of our passengers remain an absolute priority. Air Arabia has taken all of the health recommendations, circulars that are issued by the Ministry of Health, health authorities, the national disaster and crisis management teams, the General Civil Aviation of the UAE, and all other authorities have taken them very seriously and have implemented them as they came. And I think the safety tips on board are no different than the safety tips anywhere else, where people are highly recommended to monitor their personal hygiene, wash your hands, and keep wearing masks and maintain distances from one another. And that keeps you safe on board or on the ground or wherever you are. It is, when it comes to aviation travel, it's always recommended to have tested yourself before travel. That keeps yourself and other fellow passengers safe. And if I would like to add one thought, probably is an interesting fact, if you like, and that is the air circulation on board a flight is just as clean and purified as a medical operations room. So it makes it probably safer than our offices and our homes to be in. Inshallah, you'll fly safe always.
I myself cannot wait for the next chance I get to travel overseas. Thank you, Mr. Claire, for your insightful response. The crisis has definitely taught us all to really value the ease of travel and experience of visiting a new country.
Shukran, Fatma.
My next question is for Mr. Devaraja from Enterprise Singapore. I'm sure in your work you speak to a lot of businesses across different industries. Can you just share with us, please, what some of the key challenges that the businesses are facing at the moment?
Sure. Thank you and good afternoon, everyone. I'm Sugu, Regional Director at Enterprise Singapore's Dubai office. Enterprise Singapore is the Singapore government agency championing enterprise development. Our Dubai office is a regional office and we cover a number of geographies in the GCC and North Africa. This has definitely been a challenging year for businesses and it's been filled with uncertainty for everyone. Beyond the effects of COVID, there have been other macroeconomic and geopolitical factors that have also not been very favorable. Businesses have had to overcome the COVID-related restrictions, travel limitations, and grapple with new ways of working. Technology has definitely been helpful in this regard, but it has still been a challenge nonetheless. I mean, Zoom is today's new way to go, right? People have forgotten to pick up the phone and call, but they prefer to have a Zoom call with video and so on. Secondly, with budgets cut across the board, businesses have had to be careful on managing their bottom lines and are extra careful in measuring returns on initiatives or investments that they're making. So for the first time, we are also working on virtual exhibitions, pavilions, and so on. COVID has also been an impetus for companies to digitize. So companies are now looking at their entire value chain, trying to reduce their costs, ensuring that their businesses continue to remain sustainable. And it has made businesses look at innovating or developing new income streams.
Yeah, I fully agree that this pandemic was really hard on different businesses, and it really calls for a complete reevaluation of the way the businesses will be running. Thank you very much, Mr. Devaraja. Now, Mr. Tim, you head up a creative agency, and according to your LinkedIn profile, the agency People is all about creating experiences. What is the future for live events, in your opinion, given the regulation for social distancing? And will some of these changes be permanent?
Thank you, and thank you for inviting me to this panel today. What we're experiencing today on this Zoom call is essentially the new live events industry as we see it now, unfortunately for us. The future of live events is the million-dollar question that we ask for our industry, and as everyone will know, all of the events that were due to happen have either been cancelled or postponed, or even postponed and then cancelled. And events like this are transferring to new technologies such as Zoom and others. For me and our agency, the live event industry has been around for hundreds of years. Back to the days of theatre, that was essentially a live event and continues to be. So we fundamentally believe that the importance and power of live will come back in the future. And the reality is that the power of live experiences are about connecting people, bringing people together, moments of celebration, shared experiences. Today, you've mentioned wanting to give someone a virtual hug, which you couldn't. actually, if we were live on a panel, you would have been able to do just that. And the emotion that you two could have had would have been so much more impactful. And of course, you're trying your hardest to get it across over screen, but you can only do so much. That's what live events are for. They're for bringing people together. They're for creating a moment of emotion together, whether it's a mass crowd or smaller. Another example is if you were to watch your favorite band, would you rather watch them at concert or would you rather watch them on your couch at home? 99% of people would like to watch them live. So in the long term, we fundamentally believe that live events will come back for those reasons. In the short term, there are changes. So what we're experiencing today is what we would call a virtual event, which are what most people call online events. For us, a virtual experience is something where you're trying to recreate what you would have done live online in some way. There is also another type of live event, which is becoming more and more apparent, which is what we would call a broadcast event. A broadcast event is one where you accept you can't do what you wanted to do live, and you monopolize and amplify the concept of it being on TV. And you do that through a new experience that wouldn't have happened if it was to be live. And then there are many, many parameters around that in terms of different rules and regulations around the world. Can you have 10 people? Can you have 40 people? Can you have 100 people to events? We are, of course, very lucky here in the UAE that the current pandemic is on track and doing well in society, which means for us, events certainly in Dubai are coming back. We have an office in the UK. It's no secret that the UK is somewhat struggling and we don't see events coming back for many, many months, if not over a year still. So for us, short term, people will get to grips with virtual events and they will continue to happen, virtual or broadcast. And in the long term, I do think there will be changes. I think there will be changes in terms of the way that the entry protocol way works for events. So it might be, for example, capacities. We've already seen some capacity-driven events, but that's very difficult when it comes to something like a festival or a concert where it's difficult to control the crowd dynamics. We'll definitely see a difference in terms of sanitization becoming a permanent thing in events. And of course, when a vaccine does come, there will be multiple different types of vaccines, maybe with different parameters. So part of your booking system to an event will include certification of that. And upon arrival, you will, of course, be asked to prove that. So for years to come yet, the way that you enter an event will be so much different. And our aim is to make that as safe as possible as soon as we can, but to bring people together. And just the last thing I'd say is that's from an audience perspective, the impact on events. Perhaps one of the biggest changes that people won't see or be aware of is behind the scenes. Our industry was one of the first to go and be one of the last to come back. Because of course we promote bringing people together. And I feel that there are a lot of industry specialists, whether individuals or companies or agencies such as ours, that unfortunately are suffering hard. So I do believe that the back end, the behind the scenes, the back office of the delivery of those events will see a much more changed dynamic and world. Where perhaps agencies and companies operate in a different way in the future to be able to deliver events.
Thank you for your insights. I sure hope the live events will come back to life again. For our fourth speaker, who is also a BIA employee, his passion project is 20 grams, an artisanal coffee cafe. Awesome. As an F&B establishment owner, how did COVID impact 20 grams? And did you have any online presence or partnership with a food delivery mobile app?
Thank you very much, Fatma. Thank you for inviting me to this virtual event. The impact of COVID-19 was felt by different businesses of all sizes, small and medium. And for us as a small business, we witnessed a decrease in sales. But we decided to put our people first, both the staff and the customers. And there are different ways that we looked at to consider during the during COVID-19. We wanted to ensure that the business follows all the regulation when it comes to health and safety that were put by the government. And besides that, we made sure that we have a strong cash flow management where we try to minimize our spending and look at different revenue streams For example, we introduced new products to meet the customer's need. An example of this would be brewing gadgets, where customers can use them at home and make their own coffee instead of coming to the coffee shop. Another area that we looked at was inventory management, because when it comes to to food and beverage, most of the inventories are food items, and they last they have a shelf life of around 3 days, and you want to make sure that you use them before they expire. So instead of, because previously we used to do this on a monthly basis where we forecast our need, but during Corona we made sure that we do the forecast on a daily basis and understand the customer behaviors and how much inventory do we need. Besides that, we empowered our staff for them to make quick decisions to adjust the business to adjust the business according to the situation they are in. And besides this, when it comes to signing up with digital platforms, we signed up with two different platforms. One was a delivery platform. The other one was a platform that allows customers to order from their car, so they don't have to come to the coffee shop. So by the time they place an order on the app, and by the time they come, their coffee is ready, and it gets delivered to their car instead of them coming to the coffee shop.
Thank you, Alson, and we'll be sure to check out 20 grams. My last question is open to all four panelists. In your opinions, how will the crisis shape businesses in general? Mr. Devaraja, if you could go first, followed by Mr. Tim, Mr. Atlea, and ending with Mr. Alson.
Thanks, Fatma. So I think, firstly, there's going to be an increased demand for direct-to-consumer brands. Traditionally, a lot of different industries have had middlemen controlling supply chains and so on. But with the localization of supply chains locally in most geographies, I think this is going to really disrupting. And you've already seen a number of new brands come on board in the last 6 months. So that's the first. Secondly, I think there will also be new modes of business development till live events restarts, like we had just discussed. And people are going to spend a lot of effort online, given that consumption's also moved online. Brands are going to spend a lot more money in terms of marketing, in terms of brand design. A lot of it is going to be online more so than offline. Yep, that's it from me.
Just so from my side, I feel like our industry will definitely change shape in the future, and for businesses, I feel like the financial models will change in the live event industry. I agree with the last comment in terms of whilst live will continue to exist and will thrive when allowed, the ability to combine live and virtual or broadcast, so the ability to deliver a conference live for 1,000 people, but for 10,000 people to get a better or a better than before experience by watching it online will continue. So I actually think the reach of live events will become bigger, which will change the way that our businesses in the industry are affected. And finally, perhaps stating the obvious, but the ability to work remotely is of course being forced. And the early days of that, most people or most businesses struggled with the efficiency. I believe in the future, there should be a push and will be a push to make working from home or from different places an effective way of working to improve perhaps mental health, ways of working, society, so on and so forth.
I think I agree with both my colleagues here, and I think the change in the environment would be of two ways. One is the current phase, where we're living COVID, and the way it have hold some business completely, like most of ours, the restaurants, the events, and us as an airline. And another view is the long-term change. I think in the short-term change, we say in Arabic, مصائب قوم عند قوم فوائد, which means the miseries of some are the prosperities of others. So some businesses have actually thrived during the crisis and have made lots of money. So if you had a business that is selling masks, for instance, you've done a fortune during the crisis. but other businesses have come to a complete full stop. Now, there are businesses that, in the long run, now speaking, would not change completely. They would go back to the way they were because you cannot go without them. So a restaurant will remain a restaurant. You cannot dismiss the fact that people want to go out and eat. You cannot dismiss the fact that people want to travel. There might have some changes in terms of manners, in terms of way things are done, but we'll go back to those businesses. I also think that this will open the doors to completely new businesses. I think new industries will be formed on the basis of this COVID. But I think time is yet to come and tells us what's right and what's wrong in that.
In my opinion, I think most of the businesses will increase the use of automation and technology, and they will start preparing and planning for the times ahead because no one expected anything like this to happen. And then another area that I think that needs to be focused on would be, because as a business we can open, but I mean, we're not sure if the customers are ready. So I believe that businesses should replan their customer acquisition strategy and try to attract the customers back to the businesses. Thank you.
Thank you so much to our panelists for joining us today and for shedding light on the state of businesses as we head into a new normal.
Now, as we approach the end of this afternoon's webinar, we have heard some fascinating personal insights into COVID-19. We have been fortunate to talk to a frontline worker treating patients, very inspiring one. And we were also honored to host Dr. Shamsa Luta from the Ministry of Health and Prevention. Of course, the fight against this pandemic has not been over yet, but we have learned a great deal about the efforts of our country, of our country's talented, dedicated frontline workers, without whom our life would have been very, very different. Now, during the pandemic, BIA was heavily involved in the National Disinfection Program to keep our environment clean and safe. Now, to find out more about the men behind the personal protective equipment suits disinfecting our neighborhoods, here is a short video which showcases a day in the life of BIA forefront employee.
कर्मचारी 3 कोभिड-19 सफर सुरुमा डरलाग्दो थियो। मलाई थाहा छ धेरै मान्छे यहाँ र नेपालमा रोगबाट डराइरहेको छ। यति बेला समूहलाई सहयोग गर्ने र वातावरण सुरक्षित राख्ने कम्पनीमा काम गर्ने पाउने र मेरो ठुलो गर्व छ। अहिलेसम्म हामी कार्यालय र सार्वजनिक सुरक्षित कीटाणुहरू बनाउने काम गरिरहेको छ। यति बेला सहयोग गर्छु।
लोग हमें ज़रूरी कारकुनान कहते हैं, कुछ हद तक कि हमें हीरोज़ कहकर पुकारते हैं। मैंने अपने ख़ानदान को छोड़ा है, मैं उनको बताता हूँ कि क्या हो रहा है और मैं दूसरों को महफूज रखने के लिए मैं क्या कर रहा हूँ। ये मुझ पर बहुत फ़ख्र महसूस करते हैं।
I was a part of the UAE National Disinfection Program every evening from March to July 2020. In the first week, when we started disinfecting public centers, streets, and buildings, I remember looking up and seeing people clapping and cheering from their balconies. I was very moved by this.
For highlights from today's event, do check out BIA's Instagram stories and posts at BIA UAE. To everyone watching, it was a pleasure to host you today at this virtual webinar. I hope you have learned more about this important subject. Please spread the word to your friends, family, and colleagues about the important steps we should all take to keep our community safe. Thank you.